At Telecare, we exist to help people recover their health hopes and dreams. My dad was a huge force in my life, and I think even though I didn't expect to ever go into his work, the fact that he wanted me to carry on his legacy and actually told me that before he passed, even to this day, I think has shaped my inspiration for this work.
It was a family business with a great legacy and sense of purpose and passion. And we both, but Ann especially, really felt that she could run this company and grow it and transform it. Ann brought a focus, a drive, a passion, an enormous commitment to the legacy that our father created, and a real capacity to work very hard in order to transform this corporation.
Ann just delved herself into the issues and learned as much as she could, brought in as many experts as she could, and would sit down with us and instruct her staff to find a solution we could all live with and be proud of.
Jim Collins really helped me think about a framework for how I wanted to lead, about how I might build something that was more effective, more powerful.
The balance that Ann was able to gain here was sort of different than a lot of companies that I had seen. That the mission of the organization of really helping folks with mental impairments was central to everything.
I wanted to create a culture that was about this future mission, and I wanted this to be a family business that I really eventually made a family employee-owned company, to be about building for the future and building for a broader purpose.
She's got this amazing blend of, high quality, data-driven, mission-driven, focus, but it's coupled with this deep care about the culture, about how employees feel, and about a recovery-oriented focus.
When you look back at how things have changed since Ann took over, it's really amazing when you see the breadth and the extent of it, how broadened to community behavioral health care, going beyond just mental health issues.
We aggressively moved to expand our service system into an array of outpatient services. So now today, 50% of what we do is community-based services and 50% is inpatient.
She always strives to achieve more and more and more, and it's all for the good. It's a core of who she is, mental health and helping people that are disadvantaged.
What was remarkable about Ann is that she was always a team player. She was never, I have an answer, but what do we need to do and how can we work together to accomplish something?
Ann just makes you want to come here and keep doing the good work.
I really stand on so many shoulders in this work. My board, my management team, past and present, the boards of supervisors of counties that we've worked with. This public-private partnership is making systems of care more effective and more efficient. We've been partners with Alameda, San Mateo County for 30 years.
Ann's impact on the industry has been tremendous. She has elevated the safety net behavioral health services and has proven to the industry that recovery is possible through services that are stigma and discrimination free.
Most recently, we partnered with Santa Clara County on the first behavioral health pay for success program in the country. We've been partners with Kaiser Health Plan since the very beginning. The willingness of states and counties to reimagine the system of care, to believe about recovery as a possibility and to invest in it makes all the difference.
She recognizes that if we're going to make progress, it's about her company, Telecare, thriving, but it's also about building a broader system so that more providers can help more people.
Proposition 63 in the Mental Health Services Act was one of my most delightful moments to actually work on that and see that pass.
Ann stepped up, and she was one of our strongest supporters of Proposition 63, and now it's generating $2 billion a year for mental health services in California. I will never forget that.
What makes Ann the most passionate is seeing that the mission is being accomplished in the sense that We are really continuing to grow and to serve and care for people that really need our help.
What Ann has done and continues to do is to show that recovery is possible, that mental illness does not have to be a life sentence of disconnection and unemployment. That takes leadership. That takes somebody who is willing to commit their life and their business to the proposition that no one should be forgotten. That's what Telecare does. That's what Ann does.
We barely scratched the surface in terms of the need for behavioral health services, and there's so many threats out there. So looking towards the future around whole health and the importance of integrated behavioral health with substance use and with physical health. We're working very hard on models of population health that will deal with that. So those are areas that could easily take another 20 years to make a dent in. So that's a very important and powerful and exciting for direction for us to be moving in. Everyone at Telecare, this isn't just a job. This is really a place to do very meaningful and important work. And I think a characteristic Telecare employee feels darn proud about that.